I'm Dr. John McCann, and I'm going to talk about the use of Botox to treat headaches. Many insurance companies now pay for Botox injections for chronic migraine headache. Chronic migraine headache means that you have a migraine headache approximately half of the time. If you only occasionally get migraine headaches, it will not be covered by your insurance company. There are also other criteria typically imposed on you by the insurance company. For instance, you have to have seen a neurologist, you have to have had an MRI scan, and you have to have tried a number of different standard non-Botox treatments for chronic migraine headache. If you have tried all these things and you're still having headaches more than half of the time, often insurance companies will cover this. To determine this, we need to have you come in for a pre-treatment evaluation, and then my insurance specialist will work with your insurance company to be your advocate to get it covered by your insurance company. This is a lot of extra work for our practice, but something we're glad to do and a service that we offer to our patients. If the patient meets the insurance company's criteria for payment for Botox injections for chronic migraine headache, it will take about 3 or 4 weeks between the pre-treatment visit and when they can actually get the injections. If insurance doesn't cover the cost of Botox injections, then it costs roughly $1,200 4 times yearly to get Botox injections for migraine headaches. For many patients, this is not affordable. But for some patients, by adding up the cost of their current medications they use for migraine headaches and the cost of missed days of work, it makes financial sense to do so. Prior to receiving injections for migraine headaches, patients come into our treatment room. The face is wiped clean with a medical grade cleaner, and then the areas of injection are specifically wiped with alcohol to give us a sterile field to work within. A numbing cream is applied for 10 to 15 minutes so that the treatments will not be painful. The injections are then given with injections focused in between the brows, in the frontal region of the forehead, over the temples, and in the back of the neck. The treatments are not painful for patients. They may leave some mosquito-like bumps on the face. These mosquito-like bumps will fade away over a period of roughly an hour. It takes about 4 days after Botox injections for patients with migraines to see a reduction in the frequency and severity of their migraine headaches. They receive a benefit of treatment for roughly 3 months. I believe Botox injections are the safest treatment available on the market to treat migraine headaches. Certainly when one compares the systemic toxicity of over-the-counter medications such as aspirin and Tylenol to the systemic toxicity of Botox, aspirin and Tylenol are clearly much more toxic medications. This is why I believe Botox is the safest treatment available on the market to treat chronic migraine headaches.